Welcome, everybody. Welcome to another community conversation with Paul Manley, this time with Sidney Madden, the head of the United Way, Central and Northern Vancouver Island. My name is Ilan Goldenblatt. I will be hosting and passing over to Paul in a minute here. So first, I'd like to acknowledge that we are on the traditional territories of the Nanaimo First Nations, and that the Nanaimo Ladysmith riding also includes traditional territories of the Snanawas, Stuminas, and Layaxan First Nations. People can post comments and questions on the YouTube channel, and I will jump in and pass those questions on to Paul and Signy. I remind people to please remain friendly in the YouTube chat channel, and no personal attacks or any kind of foul language, and Lori will be moderating there. And now I'd like to pass things over to Paul.
All right, well, thanks again, Ilan, and welcome everybody to another community conversation. We are here in my office in Nanaimo territory, and the riding that I represent is in the territories of Nanaimo, Stuminas, Snanawas, and Layaxan. And it's an honor and a privilege to serve this riding and serve the people of this riding. Just to give you a little bit of an overview of what the summer looks like, the standing orders of the House of Commons, those are the rules that we live by, how we operate. They tell us when we have breaks and when we don't have breaks, and the standing orders are that we break for the summer after the third week of June, and we go back to Ottawa for the third week of September. This year is a little bit unusual because we are having 4 sittings during the summertime, and the next sitting is next week on Wednesday, and they are full sittings of the House of Commons. When the government can bring forward legislation, there's question periods, there's opportunities for debate on any legislation. If there's a ministerial speech, there's a chance for the Green Party to respond. And I take part in those online in the virtual parliament. They're a virtual hybrid. So there is somebody from the Green Party or one of the independents. So last time it was Elizabeth that was in Ottawa. This time it's Jody Wilson-Raybould because she's an independent and we share time with her. And then Jenica Atwin. And on August 26th, I'll be going to Ottawa to take part in the hybrid parliament. Of course, there are lots of other things that need to be done as an MP in the community. Lots of work. We have constituents still that are in other countries that are trying to get home to Canada. We have lots of constituents that need help with a variety of things related to the federal government, whether it's the CRA or Service Canada, any number of things. So I'm working here at the office, and we have staff at the office, and we're available by appointment. So we have opened back up. We've got the plexiglass screen at the front, and hand sanitizer and masks available. And if you have issues and you need help, we're here to help you. So it's a pleasure tonight to have Sidney Madden from United Way Canada, Central Vancouver Island and Northern Ireland. And Signy and I have been discussing things since before I was elected and now that I'm elected, but also during this COVID crisis. There's issues that fall under all the jurisdictions that the United Way is dealing with, and the United Way is an umbrella group, as you know, that deals with a lot of the different non-government organizations and deals with the multiple levels of government in this region and across the country. So welcome, Signy. I get you to introduce yourself, tell us a little bit about how long you've been working for United Way, and tell us a little bit about the organization.
Thanks, Paul. I'm really grateful to be here with you and your audience. And yeah, people don't know that maybe Paul and I are neighbors. So actually I can step out of my house and shout down the street and say hi to him when we were in COVID, particularly in the first stages. So it's nice to have you as a neighbor and representing us. Thank you very much. And thanks for this opportunity to talk about what United Way is doing, and in particular, the challenges our communities are facing. So I'm Sidney Madden. I've been executive director of the United Way. The United Way that I'm with is from the north of the Malahat all the way up to the end of staff and volunteers, and we're funding programs and doing community development work and driving solutions. Campbell River, Courtney Comox, Oceanside, you name it. And one of the great things about being United Way is not every community is the same and not all issues are the same. And in fact, we can learn and test something in a small community and then take that into another community, or we can test something in a larger community and take it into a smaller community. So that's one of the joys of working on the island, working in multiple communities and obviously on traditional territories, and working with our off-reserve organizations as well. So I've been there 8 years, and I think a lot of people probably, most people traditionally know the United Way as, we kind of called it the old style, which was, if you didn't know where to give, United Way was a great, safe place to do it. Long before you could give online, long before you could, we ran workplace campaigns, we collected funds, and then we invested that in a lot of single issue topics or organizations. So to help people when they're terminally ill or passing, we'd be funding hospice. To help people whose children had certain challenges or disabilities, we'd be funding those single issue pieces. And so for a lot of people for years, they figured, United Way is great if I don't know where I want to invest my money, but if I do, I'll just give directly. And I certainly encourage people, if they volunteer or are active with an organization, just give directly if that's how you feel. But one of the things we started to see, and it's good 20 plus years now, but even more so in the last 10 years, a lot of the social issues we're looking at and addressing in our communities are more complex. You have, we have homeless seniors. So somebody could be, 72 years old and they're only been on the street the last 2 years. They might have gone to a seniors program, but actually they're homeless as well. And so many of the social issues that single issue charities used to address now are much more complex and require more conversations across government and nonprofits, and actually taking a look, are people in our organizations doing what they say they're going to do, and who's monitoring that they're actually producing some results. And so a lot of our work since I've been there with the United Way over the last 8 years is to go, what's fantastic in the nonprofit sector? Where are the gaps, particularly in some of our smaller communities or the islands off the Vancouver Island? And how do we, as I call us mindful meddlers, and I shouldn't say that in public, but I call us we care. We know a lot about what the single issues, and we also know a lot about the various levels of funding. So we're in there working with government and nonprofits to go, what used to work 5-10 years ago before, the opioid crisis got worse and worse, doesn't work anymore. So how do we identify a new solution? How do we fund that? How do we monitor that? And how do we actually learn from, if we're going to we tested a drop-in center up in Comox in the library a couple of years ago, and that was for street population. It worked fantastically. It's now evolved multiple layers, and we're using that to help other United Ways and other programs across the country. So, we kind of were a simple money in, invest in good communities or good organizations and programs. And then we got into, we've got to figure out more complex solutions and monitor and reward and drive excellence. Long answer, hopefully that's helpful.
No, that's great. And one of the great examples of what United Way is involved in now is just dealing with this homeless crisis that we have, not just here in Nanaimo and Ladysmith, but it's happening right across the country. And here we have the Nanaimo Homeless Coalition, which is a whole bunch of different organizations. If people aren't aware of it, there's a long list. It's about 30 organizations or something, right? Mm-hmm. And there's the Reaching Home funds, which are federal funds that are there to help these organizations. And it's the United Way that's really is the recipient of those funds. So can you tell us a little bit about that? I know that one of the things that I advocated for right away, as we could see the COVID pandemic, spreading. We knew it was going to hit Canada. We knew that our vulnerable populations were going to be hit hard by this, and also that if we didn't take care of people on the street, if we didn't take care of the homeless population, we could have the pandemic spreading. And so, I advocated for increased funding for homelessness, and we got increased funding for the Reaching Home program. Do you want to just tell us a little bit about the Reaching Home program and what some of the organizations involved with the coalition?
Yeah, sure. Yeah, and I remember those early days of COVID, and one of the pledges we all made was let's keep it out of, let's keep the homeless population safe because they're the most vulnerable. They're moving around, and I remember, like in the early weeks, some of the homeless folks who were coming to food programs we fund down in Duncan or up here in Nanaimo, they didn't even know what COVID was. And that baseline education, with the federal dollars was so key. And, and I just want to thank you, Paul, because holy cats, like the amount of work we did those early weeks just to figure out what do we have to do, how can we respond, what kind of level of federal support we could get, and making that case for us. So, all of us were working, day and night to figure out solutions and get ready. And one of those pushes was to get more federal funding from Reaching Home, and it was COVID related. And so, Reaching Home is an amazing program across the country. Not every community in Canada gets it, but we were able to make a case good 12, 13 years ago to get funding, federal funding to address homelessness. And it's without that funding and without that support, many of the programs that you see operating that help either do food, connect people to housing, identify where they can store their, get a haircut, get their medical supplies, all of that kind of stuff are supported through programs that are funded through Reaching Home. And so for every year, the coalition, we manage that and work with co-chairs, which are from two nonprofits in town, Salvation Army and the CMHA, Canadian Mental Health Association. They co-chair it. We work with them in the city. And in essence, we get federal funding, it comes into the coalition, and we go, what are we going to do? How are we going to support to get more people off the streets? And we also do research. And so one of the things we do every year is what we call the point in time count. And I'm going to make my pitch now. For the next time we do a point in time count, I'd love for people to volunteer to help us with that. We did our last point in time count in March. We were one of the last communities to do one. We have over 400 people who are absolutely homeless just in Nanaimo. I could give you those same stats because we did the point in time counts in the other communities that our United Way serves, but we've got over 400. Now that, if we hadn't been doing the work through the coalition, hadn't had the Reaching Home funding coming all these years, we would have ended up with probably 800 homeless on the street just over the last, say, 4 to 5 years. So I think what I can say is because we have federal dollars, probably up till about 4 years ago, we kept developing new programs. We were moving people into housing, helping them get into resources to deal with addictions. About 4 years ago, we got slammed a huge increase. So, we went from 200 homeless to over 400 homeless in 2 years. And a lot of that has to do with the increase in cost of housing. And obviously, opioid addictions is also as a piece of that. So, what we do through the coalition is manage those federal funds and work to find better solutions, and measure what works and doesn't work. And this year, because of the pandemic and COVID, what we were concerned about was we get a massive outbreak within the homeless population, and they're going to other services and shelters like the Unitarian shelter and that. And then we're infecting, so many others who are working with them. And so really it was a pledge, and we've been blessed because of the hard work and the funding that we've got to keep COVID out of the homeless population. And so a lot of stuff is just, how do we, a service where you're feeding the homeless, and now you've got to deal with all of the needs around COVID. It's just, a lot of it was scaling up, you know, I remember one of the things we had to fund very quickly was hand sanitizer, you know, masks and all that kind of stuff. The hospitals were getting it through the healthcare, but, you know, on the street level, our nonprofits, you know, it was the United Way and federal dollars that came in. So, you know, it's really been a concerted effort with the city, your funding and the federal funding to get ready for COVID, educate the homeless population, and then start to tweak all the services so we can still support people but keep them healthy.
One of those things we were talking about before is just the mythology around homelessness, that it's people from somewhere else that have come here. And I think that with the point in time count, you know, it really showed that these are people who are from Nanaimo. And we had a crisis in housing here because of the increased cost of housing, the real estate boom, and people are you know, houses are flipping and sold into the market, and people end up homeless. I have a question from the chat, and this is it says, how do we participate with homeless and housing organizations? I'm a peer outreach worker who's been trying to participate with them and have been unable to connect or told it's private. Peers, people who identify as substance users or people with mental health challenges, are feeling incredibly pushed out when it comes to working with the homeless. So this is somebody.
It's a great question.
Yeah.
Yeah, and you know, one of the pieces we were doing in March before COVID, February and March, was doing community consultations with peer. You know, we had a whole set of peer meetings set up, and it got canceled because of COVID. And we were just like this morning going through a process. So hopefully, if somebody can get my email, they can send me an email directly. And I know that there's going to be a bunch of Zoom meetings, and I think they were talking about some in person with a very small number of folks, with so peer groups could get engaged, give some feedback on what services exist and don't exist, and help us in this next planning of direct services. So, you know, thanks for your patience. And yeah, it's been a challenge over the last number of months, particularly. To have people even, you know, we're doing everything by Zoom, basically.
Yeah, trying to get people engaged at this time is difficult. And the peer support is really important. I mean, people have a really good understanding of where people are at and what they're going through. We were just up at Wesley Street, and Wisteria was up there feeding people. And one of the people that's involved in that organization is a peer worker, who's somebody who's had experience and can really relate to where people are at. And it's important. I think it's one of the things that I found, you know, working with people in the diverse abilities community, for example, is people really want to give back. You know, when they've had help and they've you know, had help with organizations and worked things out in their lives, they're really wanting to give back. And it was one of the things I just loved about working with the diverse abilities community. And I did a short video with the Nanaimo self-advocates, and they were all, you know, they go and they volunteer at the 710 Club, and they volunteer at the Salvation Army, and they want to help people.
They're amazing. Yeah, they're amazing. So, yeah. I meet them all over there. Like I go, you know, programs we're funding, or I meet staff that are running these programs, and they're the most effective and the most amazing people. And I'd like to shout out some, but I won't. You know, they're people who've had opiate addictions. They've been homeless. You know, some of the most inspiring, amazing young people that I've seen and we funded through programs. Like they're the ones who they walk the talk, and they're so committed and passionate. And, you know, I think that's why getting peers engaged is so key. I mean, I know there's a CAT team here, and the city manages that with the advisory group and that's very peer driven around the opiate addiction issues. And so we're trying to figure out how to integrate them or with the Homeless Coalition, because they have a lot of knowledge and experience and can, as you say, volunteer. But I do, Paul, want to say, you know, that piece about the homeless population being locals, you know, that's a myth I keep speaking to wherever I go. And thanks for bringing it up, because I've been meeting recently a whole new cohort of folks that were helping through programming, and they're homeless seniors who have never been homeless before. They don't necessarily have multiple layers of challenges. It's just affordability. And so, that they're just local people who are on fixed incomes, living in rental apartments, and then their apartments were turned over for whatever reason. And, that's part of a public sector, private sector piece. So thank you for noting that, so that these are, as we say from United Way, these are our neighbors, and they're citizens, and they vote, and they are people who deserve, like anyone else, to have a home.
Yeah. Well, it's one of those things. The first time I was able to get up and speak in Parliament, my first question was about homelessness and the crisis that we face here and in ridings across Canada. And the federal government had stopped putting money into affordable housing and into co-op housing decades ago, and now we're seeing the repercussions of that, because when everything is market driven. The market decides Nanaimo is a hot place to be. It's such a beautiful community, and it's been discovered now, and this is the consequence of that. So it's one of the things that I've been pressuring a lot on, and I've worked with a number of organizations here that have different projects that they're running into issues with, and I connect them with the parliamentary secretary and with the minister and with staff, CMHC. Most of the money flows from the federal government to the provincial government for this issue, but we've had some really good news this week with the housing announcement with BC Housing and the city announcing over 300 new homes. So
we're pretty excited about that, and I know the city staff and local service providers worked really hard, and it's not enough, but that's, at least we can look at people moving out of the modular housing, the temporary housing that was established after Tent City. And also, there's a good chunk of housing for, vulnerable or people on fixed incomes. And so, that issue I talked about, which was, seniors or others who are on fixed income suddenly losing their housing, if there's, purpose built and developed for, fixed income or low income folks, we don't want to have them go into the homeless population and have to deal with all those challenges. So it's a fantastic news, and I hats off to the city and BC Housing and everybody who was involved with that.
Yeah. No, it's good. It's great work, and it's great to see the community coming together, all levels, to make these things happen. I want to go back to seniors, because you're the United Way is involved with seniors, and there was funding that came through for seniors through the New Horizons grants, and I've worked on New Horizons grants before, actually training seniors in video production and then making stories about food and the things that they were interested in. We did some great stories.
I didn't know that.
Yeah, they're all on the Nanaimo Food Share website. We did a profile of seniors working at the Food Recovery Warehouse, which is such an awesome thing that the food bank is doing. We did one with the self-advocates. We did some profiles of like Frederick's Honey and things like that. But this time, New Horizons for Seniors got, there was an influx of funding through that program to help with COVID, and it went to the United Way. And I've had some concerned people contact me and say, well, it goes to the United Way and it goes to another nonprofit, and it's like all down the line, everybody's taking a cut. And I'm like, that's not how it works, so you want to just talk about that process a little bit, because what happened with that money, how does that get divvied out in the community, and how is that helping seniors?
It's funny, we keep hearing, it's an interesting thing about the United Way and other charities. It's somehow we're getting rich, and we're spending all this money, government money. I'm like, I'd like to tell my staff that, but it's for the New Horizon funds. We got 120,000 for our region, and we keep 5% of that for administering the funds. And so what that involves is, we do a call for proposal. We rate all the calls. We have to contract them, and then we monitor and figure out, are they actually doing what they're doing, what they're supposed to do with the funding, and or we will defund them, or we will bring the money back in and fund somebody else. And so that's, you know, in terms of just that New Horizons piece, and that was true also of the emergency community support funds that came from the feds. And I know you were engaged in that piece as well, Paul. And you know, just heartfelt thanks for that additional funding into the community, both the New Horizon and the ECS funds. You know, just as we're trying to help the nonprofits get reopened, like Code Dental Clinic, we funded that for years through our donor dollars. Thanks to my donors out there. And that helps people who can't afford to go to the dentist, right? So that's, you know, and that includes seniors who are, you know, on fixed income. So an example, Code Dental needs to renovate and do some work just in their clinic so that the dentist is safe and the patients are safe. You know, that's the kind of, you know, so we meet with Code, we go, what are you doing? What are you going to do? You know, we curate that and figure out, okay, that's a good solution. Maybe we can find something over here. Hey, I know somebody else who can donate that, bring that in. And I think that's the role of the United Way in a lot of this work is, you know, and I'll mention just, you know, when COVID hit, one of the biggest things that was needed was, how do we know which services are open, which services are closed? How do we know who's, you know, referring to whom, and how do we support those folks? Well, it was the United Way working with all these coalitions and the city and folks like you, you know, our elected officials. You know, every week we're going, who's open, who isn't. We're putting it on our website. We're finding out, you don't have any food, your food bank's closed in your small community. Let's move some stuff up from here to there. And, you know, that's the stuff people don't know the United Way does. So that's just a pitch to thank my donors and the government when they support us with some admin fees. It's like when an emergency hits, we're there and we can curate a solution, connect this person who's got, you know, stuff to donate with somebody who's going to give, you know, fix something in a program. So, you know, I'm not sure I answered your question about, you know, that's kind of the, like, why we exist and what we do. And it's, a lot of it is just testing to see what works. Like I can see, you know, with the funding, that New Horizon funding, we're going, this is working, this is working. That wasn't such a, you know, it was okay. It's not that the money was wasted. So then with the ECS, you know, the Emergency Community Support Funds, we're going, let's do that. And, you know, we tested that down in, you know, in Ladysmith, let's do that in Nanaimo. So, you know, a lot of, you know, why the federal dollars were so important was it gave us resources and it allowed us to connect the dots between who's open, who isn't, who's creating a good solution and driving more of that good solution. I don't know if that answers you, but.
No, that's it. It's really like, you're the eyes and the ears on the ground. So, you know, the federal government has moved a lot of their offices into larger centers. Our Service Canada office here has been closed. And so a lot of Service Canada employees are working from home. And, you know, when I was dealing with New Horizons, I was working with somebody, you know, sometimes in Calgary, right? And so they don't know what's going on in the community. United Way knows what's going on in the community. And so when you put out that, you know, the proposal, and all of these small organizations are saying, we're open, this is the service we can provide. These are the needs that we're seeing from the seniors population. This is the food we can provide. You know, so many different services disappeared overnight with the lockdown. And seniors, you know, when you're on a fixed income, the cost of living increase, it may seem minor to working people that are making a decent wage, but it would be like 25-30% of increase in cost for people on a fixed income, and people were having a really hard time with that. Like transit, you couldn't take. You had to take taxis. You know, you have to get all of the masks and the hand sanitizer, which nobody could find anywhere. And the cost of food. You know, if you're a senior and you're going and shopping the specials, but you can't be out all the time, and you got to make one grocery trip a week, then that changes the whole equation, right? So,
and that's, you know, I I think that's the thing that a lot of people don't understand is if you have a nonprofit sector, you want to make sure they're effective, and you want to be able to help them when they need the help and let them do the great work. Like, you know, if you're running an amazing after school program at Boys and Girls Club, which we fund, or, you know, something else, is like, you go do it, you're fantastic. But sometimes, you know, I've had nonprofits, you know, they'll be talking about closing, and so we'll go, okay, you're great over here, you're great over here, there's a combination of your mandates, some of your population's the same, how about we help you merge? And that was certainly the case last fall with two of our agencies in Nanaimo, and thank goodness, because they ended up being real strong. I mean, you know who I'm talking about. They were a strong organization that was available and ready to help during the pandemic. And that, you know, people go, oh, United Way, well, I fund you. But, you know, it was United Way and the Law Foundation, actually, out of Vancouver that helped those charities merge and get stronger and serve the community in a more efficient, effective way. And, you know, Paul, I wanted to say, you know, a shout out to Sheila and the province. Just, you know, with the New Horizon funding, we also, the United Ways in BC, got funding for BC 211. And so BC 211 is a service across the country. You can text, phone, and if you're looking for services, talk directly to somebody, web chat. That's funded by United Way donors. And then the province saw, well, we'd funded this whole network of BC 211, the web chat and the phone line, and they said, let's support matching volunteers to help vulnerable seniors get their groceries, you know, take them wherever they need to if the cabs aren't running. And so that's been, you know, one of those amazing things to see a United Way funded service, and the province went, how do we match it up? And oh man, some of those stories are just like heartwarming, like seniors helping seniors, you know, a 70-year-old helping a 94-year-old, you know, and that's, you know, we've got beautiful, generous people in our communities, and they just need a vehicle to connect them.
Yeah. I got another one from the chat, and it's about the Canada Student Service Grant for volunteers, and how do you see Vancouver Island social service agencies and charities accessing and using these volunteers, and will there be a meaningful impact on the people and organizations utilizing this volunteer help? And unfortunately, that funding is on hold because of the whole situation with the weed charity. So, you know, it turned into a bit of a scandal. What we're saying, what I've written to the ministers involved and said, we should just take a chunk of that money right away and put that into Canada Summer Jobs, because this riding, I know we're underfunded by about $500,000. I could spend $500,000 tomorrow on applications that are already in from nonprofit organizations that need help, and they either didn't get any money at all, or they got, you know, not enough positions, or they got, you know, funded for half the weeks that they wanted, or, you know, it's only partial funding. And so there's a lot of organizations that need help, and the government is looking at that right now because it's a quick way to get money out. But the idea of this volunteer service grant, and I think like it's kind of reminds me of a service corps, you know, youth service corps. It's I would like to see it bumped up a little bit, because it's $5,000 for 500 hours, which works out to $10 an hour. It would be nice if it was more towards minimum, you know, at least minimum wage. But how do you see a program like that working to encourage youth to get engaged and volunteer and work with organizations?
Yeah, it's a great question. I mean, you know, and I'll just take a step back. Like, we were so focused on the early stages of the pandemic, and, you know, who's open, who's not, blah, blah, blah. Now we're, you know, working into that place of getting people reopened and getting engaged and getting the nonprofit sector stabilized again. And, you know, one of the things I'm hearing on so many of our, you know, multi-community and multi-issue tables is the concern about youth, and are they able to actually find work? You know, they're not going to university necessarily because of the COVID issues. So that's a big, you know, like for us and talking in our different communities, how are we going to support youth to actually have meaningful experiences, whether work, study, or, you know, volunteer experience. And so those volunteer gigs are amazing. I know, you know, we're blessed with our region from Malahat through the whole island. We have 2 of the regular positions, thanks federal government. And, you know, I just met this week the, you know, one that was onboarded and, you know, just for them, this is work experience and we need the help. Like we, you know, we run campaigns through the fall. United Way campaign is going to be fundamentally different because we can't meet in person. So, you know, we need the support. And I'm with you, Paul. I think getting those, you know, getting those positions funded, as you have that in your office, you could say, here's, you know, how many agencies who could use those summer students, and or through the fall, actually, most of them will be. And I think that, you know, I'm watching week by week as the nonprofit sector and the business sector are figuring out how do we operate now, and how do we support our staff, and how do we support our clients or our community, and, you know, having willing young people to be able to participate and you know, help, you know, there's extra steps for everything now, you know, through COVID. Everything we do takes twice as long just because of the COVID precautions, and we could use the help. So yeah, I'm hoping, you know, I'm hoping for Nanaimo we get, you know, because I know agencies didn't get those summer student positions or intern positions.
We could really use the help. I told the ministers in my letter to them that I could spend another $1 million on top of that, no problem. So that last question was from email rather than chat. Alan is just feeding these all to me. I often go back and make him ask questions. But just back to the funding and your campaign. So you have an online campaign right now called Local Love, and people can donate online, and that's super important. It helps all of these different organizations. And you know, when you know, you pick your charities, and I know Sam and I go through a list of different organizations that we want to donate to, and you don't always think about every one of the small organizations or some of the small micro grants and projects that are happening. And so the United Way is really the organization that can make a difference with, you know, spreading that money out and making sure that the community is covered, right? So if you have,
I mean, last year, if you've got a little extra, we'd love it, either through the Local Love Fund, which was really about, you know, buying hand sanitizer, getting masks. You know, we had a fire in one of our communities, an apartment fire, and a number of residents up Island lost all their belongings and they had to find housing. So, you know, our donors stepped up and bought people's, you know, materials and food and everything to get them resettled. So that was you know, and here Salvation Army, you know, I remember it really was hand sanitizer and water and things like that in the early days of the pandemic. I mean, last year our donors gave, you know, we supported over, you know, 53,000 people in our region, many of them in Central Island and in Nanaimo, and that was through 89 programs. And so people don't, you know, you kind of think about, oh, you know, what makes up a community, right? There's sports, and our kids are in sports, and, you know, we have our parks, and we have, you know, the hospital. We're so blessed with our hospital and our government services. But a lot of the things that makes a community is provided by the nonprofit sector. Literacy Central, I mean, you name it. There are so many. I just think of, you know, if one of the best things about my job is, you know, I'm always learning about new programs and new needs and new programs, but just, I mean, it blows me away. You know, a grant of $5,000 or $8,000 or $15,000, and I'm going, wow, you did all of that. And, you know, whether it's helping kids with disabilities or, you know, hospice or Haven Society, we've got, you know, we've been funding that Children Who Witness Abuse program for years to prevent, you know, trauma and help people heal from trauma. So, you know, our job is to understand the needs, connect all those different agencies together, and make sure people are actually spending the money wisely and doing what they're supposed to do. And that's, the government isn't always doing that. And if you give a donation online directly to a charity, that's fantastic. And I support people to do that. And I do too. But sometimes you need somebody who's going to get in there and go, you know what, there's a more efficient way to do it. Let's match you up with somebody else, or, here's something that's being done. Like, I talk to United Way colleagues across the country. New Brunswick, if there's a good idea, we'll bring it here. Newfoundland, some of my best ideas for programs that we've developed here and funded as test subjects come from Quebec, or they come from small communities in Ontario. So, that's the beauty of the United Way. We're always sharing knowledge, we're doing research, and, trying to curate the best solution. Yeah.
And you get to really have your finger on the pulse of there's a lot of passionate, caring, loving people in this community, and you really, you get your finger on the pulse and able to see what they're doing. It's quite amazing what people can do with small grants, which are often onerous to get from going through government applications. I do have another question from the chat, and this is related to provincial issue, but there is a federal angle to this too. And the question is anything happening in Nanaimo to increase long-term, no or low-cost mental health services? Barron's Road and Brooks Landing are vital, but crisis-based. And secondly, what are we doing in Nanaimo to increase accessibility to social workers? There is a long-term shortage of teams dedicated to individuals who are homeless.
Well, that's a huge, and thank you whoever brings that up, because you obviously understand the issues, and also that you have compassion around both the stress on the healthcare providers because of the huge need, and also we have to advocate for solutions. So I'll just talk very quickly, and it may not be what people are wanting to hear about, but one of the things we are sitting on is the Health and Housing Task Force at the city, and it's a City of Nanaimo task force. I'm on there, the Chamber of Commerce, obviously many service providers who work both with housing and health issues, including mental health issues. Island Health sits on that Health and Housing Task Force. You can Google either on our United Way or through the Homeless Coalition, Nanaimo Homeless Coalition, or the City of Nanaimo. And so we've been working for over a year now through the Health and Housing Task Force to figure out how many units do we need for homeless, and the point in time counts are part of that. But also, just housing people is not the solution. You also have to have other supports, particularly given the massive opioid crisis that we've been facing, and sadly through COVID, we've had an escalation of deaths and a crisis on the opioid side. So what we're working on is something called a coordinated access system, and we're working with a consultant, Dr. Alina Turner, who has driven this process with Medicine Hat, Kelowna, other communities. And so probably by September, October, we'll have a report that's coming out of the Health and Housing Task Force that says, here's what we see we need in terms of the additional number of supportive housing, but also how can we change how the service providers work together, Island Health, BC Housing, and the nonprofit sector, to support the huge number of folks who have mental health issues or opioid crisis or opioid challenges. And, so it's out of that, fingers crossed, and we certainly put a lot of time into sitting on that, as you know, Paul, and I know you've been there and sat and listened and or participated at some level with that, so that's our hope. But, in terms of the funding for and how many healthcare workers is really an island health issue. So we're trying to, influence and inform that through the Health and Housing Task Force to basically say, I remember a couple of years ago, we started to fund housing with John Howard Society, and they ended, oh, sorry.
Yep, you're still there.
Oh, I thought it was done.
Nope, I can still hear you. So yeah, I do have a staffer when, like, I can't be at all those meetings, so I do have a staffer that sits in on those to report back. One of the things, at the federal level around mental health is we need a national mental health strategy. And mental health is covered under the Canada Health Act, but not in the way that it should be. And I think that people need coverage for counseling. The problem is when people are starting to deal with some mental health issues, the cost of counseling is prohibitive. And so you have to wait until you're in crisis before you can get free counseling. And then, I've taken people to Brooks Landing and to Barron's Road for counseling and for emergency counseling. And often you're hanging out and waiting. And when people are in crisis, that's not what they want to do, is sit in the waiting room. They need to talk to somebody and work things out. And so I think that the federal government does have a role to play in working on the national standards around mental health to make sure that it's more accessible across the country to those that need it. And especially in this time, like we've been talking about this a lot in the House of Commons with the health minister. And there's a lot of awareness around what this COVID pandemic is doing in terms of mental health for people. It's, there's so much stress that people are dealing with, financial stress, worries about health, worries about the pandemic. And we get it, in our office, our phones ring off the hook. And, especially in those earlier days, the phones and the emails just continuous. And when I was elected, I never thought that I would, see so much of the inside of other people's lives and the angst and stress and, problems that people face day to day. And they're all exacerbated by this pandemic. So if people are already struggling, the pandemic has just made it that much worse. And so it's not a, we're all in this together, but we're not in this together equally. And we know that from the stats that we've seen from Toronto, where they've released statistics about where COVID is hitting hardest. And it is hitting people the hardest in vulnerable communities. We all know about the care homes, but after the care homes and the deaths in the care homes and the spread there, the spread is happening in communities that are marginalized, people that are living, more people in a house than would normally live in a house, in apartment towers where every apartment is overloaded like that. And these people have to go to jobs using public transit in jobs where they're dealing with a lot of the public, in essential service work, making sure that we get our groceries and all of these other services that we rely on. And that is the population that has been hit the hardest in Toronto. And I'm sure that is, right across the country, that would be true, that the people that where COVID is spreading is in people who are, marginalized in terms of their income, and visible minorities, and people living in poverty. And so,
and I think that's why we were really glad to get the federal funding, both from ECS and the New Horizons. Like how do we support those nonprofits that are serving those most at risk, and how do we, help them adjust to COVID, in their facilities and all that, but also, I'm sitting on the mayor's task force with the city of Nanaimo, as well as our health and housing task force. And one of the questions we're talking about is how do we support, evolution for the nonprofits in our community, so that, people aren't, we aren't seeing more homeless, because they've lost their work, or, how do we support people who've been traumatized during there's a higher rate of abuse within some of the families because they've been locked in together and that sort of thing. So, I think over the next couple of months, that's going to be our real challenge, both, working with you, working with Sheila at the provincial side, and at the city side is, how do we make sure the nonprofit sector is thriving and survives, even though a lot of their fundraising events are gone and they can't do their whatever. But also, how do we, there's hope for us to evolve too, I think, and look at how do we do this better. And out of a crisis, we're hoping that we can figure out a better way to serve communities so they're not, they're not falling through the cracks. And, I've watched that on the food security side. Like, we've been meeting with the city and other, around food security every week for weeks, and, obviously funding, the schools foundation, which we funded before because they were funding kids and parents and everything, who were not able to come to school. So I think we're learning a lot just in terms of how to interconnect the agencies who are in the past worked in silos and work together so that people aren't at risk at home.
Yeah, it's like you were reading. It's like you were getting the notes from Milan here, because one of the questions from the chat is, are any groups working on greater food security? And that is a serious issue, because we just realized from really the personal protective equipment, PPE, the global supply chain. We live in a whole globalized market, and on Vancouver Island in particular, 3 to 5% of the food we consume is grown here. The rest of it is imported from somewhere else. And you just need to cruise through the grocery store and look at where everything's from.
Yeah.
And I know Vancouver Island Economic Alliance is doing great work with the local food initiatives, right? So, but we need to really strive to increase local food production and food security for people who are low income. And we're going to see, I think, with the global supply chain on food, we're already seeing farms being shut down in Ontario because the migrant workers are all getting sick. The workers in Florida and California are getting sick, and the pandemic is going wild in Mexico. My brother lives in Mexico City, and he said that the statistics there are way off, and it's about 20 times the number of people that actually have COVID in Mexico right now. So we rely on a lot of our food being imported, and we have organizations here in the community like Nanaimo Food Share and
all sorts of the schools foundation. I mean, community kitchens. We've funded all of them for years, on and off, or steadily for years. Our donors have, and I agree. I think I think of just how do we support organizations to grow more food and to have local production of food so that we're not importing everything. And certainly the Island Good program that VAIA runs, to when you go to the grocery store and you shop in the grocery store and look for Island Good, that's about supporting
little blue island label.
So I mean, that's all driven so people understand, support people here. But you're right. I mean, I'm kind of going, we've got through the early stages of COVID here, and programs are reopening. My staff, my volunteers, and the agencies we fund. I mean, the big conversation now is, what's going to stay open? How do we stay open? And what's the size of the need? So if we've had 400 plus homeless already in Nanaimo, my worry is we're going to have more of that because people can't afford their housing. I hate to be negative, but I think the level of food support to our food banks and Loaves and Fish is phenomenal, and we're so blessed to have them here. But I think over the next couple of months, what we're going to be, you and I will be talking about it ongoing, is how do we ensure we've got enough local funding and services to help people who may be at risk because they lost their job or their housing, right?
It's really good to see the growth of the farmers markets in our community as well. The Bowen Road market that's now the Island Roots market, wasn't there 15 years ago. and now it's a super popular event.
Yeah.
And it was one of those issues too about getting that open. During COVID, it's really important to support our local farmers to get them to grow as much as they can.
Yeah.
We got one more follow-up question. Any efforts to get local institutions to use local food that would strengthen local agriculture and local food production? Gabriel Market. So yeah, absolutely. I know farmers have tried to do that with the Heritage Food Service Co-op to get universities to buy food from a collection of local farmers. And I think that's something that the community really needs to think about, how we get all these small farms, to be able to work together. Because I know one of the issues in supply for institutions like hospitals is they want so many carrots every week, and a small farmer might not be able to do that every week, but a group of farmers might be able to pull that off. So
and I think from the food security side, I'm hoping out of the weekly conversations that have been happening, one of my staff has been engaged with that and working on that, is, just how can we support, we've been funding through our donors, we've been funding community kitchens for years to teach people how to cook nutritious meals and to use local sources. And, that's a small program that's, very effective and really well received with people on low income. So they learn, they get a can of red beans and they don't know what to do with them, or chickpeas or whatever. And so, I can see that kind of programming evolving so that you're getting your canned stuff, but then you're also, connecting to local farmers, and you've got local produce that you can then use, And I know certainly, United Way donors for years, we've funded some of the food banks, when there wasn't enough meat, or, they had other canned goods, but they didn't have any protein. And we've worked with the labor unions who've donated local fishermen have donated local tinned food, and we've given that to our different food banks in our region. And that's, it's local. It's supporting, the union, folks who are working, and it helps people work. And then people have access to protein when people aren't necessarily giving to the food banks at that time. So I think that's something we've got to be looking at. And that's where I say, COVID's been so strange and stressful and worrisome and everything else. But I've also seen a lot of great people coming together, including working with Paul and your staff, and others, and going, let's think how we can do this differently. How can we solve things so that we're not just dealing with a crisis, but we're actually thinking long term? And I think that's where things like the question from your audience, how do we move to growing stuff here and getting that to the food banks? And I could see, as we develop whatever comes out of the Health and Housing Task Force and go after more local housing for people on low income and homeless, we look at how do we, incorporate food so that they have access to good, healthy food, and it's local, right? So rather than buying tinned stuff from wherever, so that's the hope.
You mentioned the community kitchens and Anita's program, and they have a cooking out of the box program from the Good Food Box, which is, food share, and they use the 5-acre farm and now the Westwood farm, which is, a historic farm, both farms in the city, and they're growing as much local produce as they can. And they put that into the Good Food Box, which goes to low-income families. And people can buy that box if they want. It supports the program. And, the community kitchens teaches them how to cook with it. So there's a last question. We're like running out of time here. We're down to the minute.
Okay, we're almost done.
Alana's like, you need to talk about youth, and will there be any sort of additional community projects like the design labs that were cut short because of COVID? It was a great project. It would be lovely as an ongoing project.
Yeah, so actually that was a meeting we had today. There's going to be a whole series of design labs. I think there's like 15 or 20 that we're planning, and so you can look on the United Way website. You can, if anybody wants to email us, info@uwcnvi.ca. We can add you on to the list and we can give you a notification. But yeah, we're planning, a bunch with youth. And this is that work with Dr. Alina Turner, our consultant, that's gathering intel to help shape what are our solutions, coming out of the Health and Housing Task Force. So yeah, I think there's at least a dozen consultations that we want to do in the next, 6-8 weeks. And so if you want to know any info, just info@uwcnvi, and we'll connect you up and put you on the emailing list or invite you to them. And we'd love to have you, whether it's a Zoom call or in person. And yeah, and that's where we want to hear from the youth and people with lived experience so that we can shape, what's our ask to the province for more housing, and how do we integrate some more than just housing, some supports for people so they're successful in moving off the streets and dealing with the opioid piece. I mean, that's going to be huge. We've got to support people to deal with that.
Yeah, it was a great project. I took part in some of those design labs, so I'm looking forward to getting together in community again, a little more than the online thing. But it's been a real pleasure to have you on for a community conversation, Signy. I'm sure we could go on for another hour, no problem. Can you just, one last time, tell us how people can find United Way to make donations and give us a little pitch?
Yeah, we have an online giving through our United Way website, uwcnvi.ca, United Way, Northern and Vancouver Island, Northern and Central Vancouver Island. So you can Google us and you can make a donation. You can designate where you want that donation go to. So if you want to give it to Food Share or somebody else, or you can just say, put it to the best use possible. And you should know we have impact councils in each of our communities, and they're made up of volunteers from province, the feds, direct service providers who aren't actually applying for funds, retirees who've been active in delivering service. And so we have a good group that go through all the applications with us and make recommendations about where the funding should go to, including our COVID funds. And so please make a donation if you can. We're really concerned. I mean, we usually raise for our whole region, 1.2 million is what we raised last year for, the Malahat. We're concerned that we're going to be down about 300,000 to 400,000 because of because of the crisis, and we don't want to defund programs. We raise the money in the fall, and then we fund the programs in the next year for 12 months. So we're really hoping that people will renew their gift if they can, and if you have a particular interest, please just tell us. Youth or homeless or seniors. We've got programs, and you can go on our website, and we're just collecting stories from many of the programs we're funding now. We're going to be funding through the ECS funds, and if you want to shed a few tears, I definitely am really moved by how amazing the programs are, how not a ton of money can make a difference. And, we're saving people's lives. Like our donors, we save people's lives. We're helping them recover from trauma, and you're able to then give back. I mean, and there's some of the most amazing, as you said, the volunteers we see, the youth, people with opioid issues, seniors who've lost housing, got their housing. They're the ones who are showing up and helping out. So, we're going to be setting up something called I Volunteer in the fall to match volunteers up with agencies, particularly through COVID because of, you can't do it in person and interview people. So thank you so much for including me and hearing about what's happening at the community level. And, thanks to Paul and Alan. I mean, the evenings we've had meetings, the mornings, the 12-hour days to try and help our community. I hope your listeners know, how dedicated you are, and, what a blessing it is that we've got engaged elected officials who are going to speak on behalf of us in the government and work with us to figure out how to invest the dollars in the best way possible. Thank you.
Make the community a better place.
Yeah,
exactly.
Thank you so much.
Thank you so much, Signy and Paul, and thank you to all the people who watched at home, and for all the people who asked questions and engaged in the chat. And thank you to Lori for moderating the chat. It was light moderating. Everybody was very respectful and friendly, which was great. And I'd like to remind people that this video, this conversation, is going to be up on YouTube, and a link you'll be able to find or refer people to a link on Paul's website, which is paulmanleymp.ca. And you can check in there. You can sign up for MP updates to find out about future conversations. We're planning a future conversation with some folks from the Gabriola Health and Wellness Collaborative as well. We're trying to line up a community conversation we've lined up a community conversation with Aaron Stone, Mayor of Ladysmith, Aaron Stone. So there's going to be more interesting and informative community conversations coming up. So please stay tuned. Thank you so much again, Signy, for taking the time this evening and for all the work that you do for United Way Central and Northern Vancouver Island. And thank you, Paul. And thank you, everybody at home. Have a good evening.
All right. Thanks,
Thank you.
everybody.
Good night.
Good night.
Bye-bye.